I hope everyone is back from the break. We'll be continuing the sessions. I would like to now call upon Dr. Valessa Joseph of Nova Southeastern University, USA, to deliver her keynote talk on the title, Communication Challenges in Nursing Education and Healthcare Effects from COVID-19.
All right, just had to unmute my self here. Hello and welcome everyone. Good morning. My name is Dr. Valessa Joseph, and I currently work in the primary care setting, and I am also an assistant professor at Nova Southeastern University, and I teach in the graduate program and teach current nurse practitioners. And so today I would like to speak to you on the topic of communication. Just want to make sure that you guys are able to view my screen. Are you able to view my screen?
Yeah, we can see it.
Okay. All right, so today I want to talk to you on communication challenges in relation to health effects from COVID-19. We know that communication is an important paradigm in both the acute and the primary care setting, as poor communication in the healthcare environment has negative implications on our patient satisfaction, our patients' compliance, and their overall health. Communication itself influences collaboration amongst the healthcare provider and the patient's experience. There is a strong correlation between healthcare communication and a patient's ability to follow recommendations, self-management of chronic illnesses, and demonstration of following health promotion strategies. And so despite prior challenges with communication that our healthcare system currently had, the COVID-19 pandemic has brought upon unprecedented barriers to communication and increasing communication challenges in our healthcare system. So with patients currently being in isolation, with current lack of necessary resources and our nurses being burnt out, and a higher level of stress, this has caused even more challenges to a already burdened system and complicated system with communication. And so many healthcare teams are looking for ways to navigate through these current challenges during this time of crisis. And this highly includes having and looking for a means of effective communication amongst patients and staff. So, however, there is no known study that has described communication in nursing practice during the COVID-19. So therefore, the purpose of this project was to conduct and look at a primary examination of communication experiences with these patients and their satisfaction and the current challenges staff is going through during the COVID-19 pandemic in the primary care setting. So the primary healthcare setting in which this project was implemented was having and was characterized by problems where there were unclear roles and responsibilities, a lack of a standard protocol, and no direction on how to communicate with these COVID-19 patients. And so a quality improvement study was done and conducted in the primary care setting using different stakeholders, which included healthcare providers and medical staff members in the primary care setting. So we used a sample of 48 patients for collection of data on their satisfaction with the current communication of the staff. A pre-test and a post-CAP survey was administered among these patients to determine effective communication among the staff members and the patients. A data analysis occurred using descriptive and inferential statistics to establish the impact of using the aided framework on provider-patient communication and patient satisfaction during this pandemic. Ethical considerations were used for patients, participants, and confidentiality of the data. And so the purpose was looking at, can we improve patient satisfaction, and can we help with the current communication challenges by implementing the aided framework in the primary care setting, which is acknowledge, introduce, duration, explanation, and thank you. So our PICO question: among providers and medical staff in family practice, does the implementation of the aided framework improve communication and patient satisfaction with the COVID-19 patients compared to the current practice? So acknowledge, is the individual provider present during the encounter? Introduce, does the provider introduce themselves, give the patient information to their identification? Duration, does the provider provide with the patient the time frame for the encounter? Explanation, does the provider do a good job at explaining what it is that they're going to do with the patient, or what is the procedure going to be and the time frame? And then ending with a thank you. The theoretical framework that was used is the human systems model. And this model is based on a general systems theory that reflects the nature of the living organism and their interaction with the environment. Human systems model was used to identify stressors and interpersonal factors between the providers and the patients in the clinical setting that might be affecting them, and the correlation between the patient's perception of their environment being affected by these stressors, and how that will determine the overall satisfaction of the patient. So the significance and methodology used is a non-probability convenience sample was used to recruit the patients from the suburban clinic that is down here in South Florida. And so a total of 48 participants were included. And the inclusion criteria consisted of an individual having to be a resident in South Florida, being positive for COVID-19, above the age of 18, and the ability to read and write in English. And of the 48 that completed the survey prior to implementation of the aided intervention tool, 29 of the completed assessments were done after the intervention. Several questionnaires had to be dropped, and that was a limitation due to missing data, so resulting in a sample size of 38. And so the aim of the project was to evaluate the impact of the aided framework in improving communication challenges with specifically COVID-19 patients and their satisfaction in the primary care setting. So in order to attain this, our objectives really were looking at: one, determining the effects of the aided framework on the staff and patient communication in the primary care setting. And we were able to do that by evaluating the CAP survey. Our second objective was to determine the effects of the aided framework on the provider and patient communication in the primary care setting. And lastly, we aim to evaluate the effect of the aided framework on the patient's satisfaction. So again, the project took place in internal medicine office, and we implemented the aided framework with all of the patient visits, and weekly huddles were done with staff to teach them how to use the framework, to ask questions, allow an open forum for discussion and feedback. So we use the Consumer Assessment of Healthcare Providers survey as a pre and a post test. And this was administered to the patients initially to assess what their current satisfaction of how the staff was communicating was done. And then we implemented the aided framework by teaching the staff members, teaching the stakeholders how to use the aided framework to communicate. And then a post CAP survey was administered to the same patients. And so some of the data collection from the CAP survey, some of the questions we asked were, did the individual meet with the staff, how they implemented the aided, the time frame that they were in with the patients, Then we collected the data from the pre and the post. So a formative assessment were performed by completing the CAPS pre-test survey prior to the implementation of the aided framework. Summative evaluations were done at the beginning and the end of the project to determine the project if it met the desired outcomes. The CAPS surveys were used to evaluate the intervention success in increasing communication with COVID-19 patients. There are about 15 questions on the CAPS survey, and the individual had to score from 0 to 10. And then the completion time was about 10 to 15 minutes with the survey. And so the questionnaire that was used was the CAPS survey. And then the analysis method, we used the independent t-test for the 2 sample groups of participants. So the descriptive statistics were generated to look for any type of violations of the assumptions of the t-test, any type of skewness or kurtosis. And then the inferential statistics was done given that the project collected pre and post intervention data for 2 different groups. So an independent sample t-test was the appropriate data analysis technique to use. And then the CAPS survey had 4 subscales. And those questions looked at if the individual was able to get the necessary care that they needed, did they get the care in a timely manner, and how well did the doctors and the staff communicate with them? And then lastly, what was their overall satisfaction? And so the results showed that the statistics demonstrated an increase in patient satisfaction once implementation of the aided framework took place, and inferential statistics were made at 5% level of significance. The independent t-test results indicated that patients rated their access to care, their speed of care that they receive, the communication between the staff and the doctors were higher following use of the aided intervention. Now, the implications for practice. So the project let us know that effective staff and patient communication does improve patient satisfaction. And this is a key metric in producing quality care to our patients. That use and the adoption of the aided framework improves provider-patient communication, thereby leading to enhanced quality of care and patient satisfaction levels and patient satisfaction scores. And then it also lets us know that this can be implemented, the aided framework, to teach providers as well as patient access to medical care, that by providing nursing education and training, it ensures translation of knowledge for delivery of evidence-based practice, that adopting the aided framework improved patient and provider communication. It enhanced the quality of care that the patients received. It increased patient satisfaction scores. It also showed that leaders played a significant role in being change management by providing support to their providers and medical staff, by administering these materials that contributed to the improvement in the knowledge of healthcare, and that this project can be applied to further research and in other venues, such as in nursing education with nursing clinical students, as well as a means to overall improve our customer experience, our patient experience with these patients with COVID-19 to avoid poor ratings. So in conclusion, during these challenging times with communication, the project proved to show that the aided framework can be used to improve communication with the provider patient, with the staff patient, with the nursing clinical students, as well as overall improved clinical practice outcomes, and helping to establish a current standard protocol for primary care settings that do not currently have a protocol. Thank you for your time. I'll take questions at this time.
Thank you, Ms. Vallesa. The floor is now open